It's a great honor to present here this work, and I'm doing it on behalf of a Fibroline company who introduced BioBridge technology into the medicine. So while the presentation is downloading, I will briefly, oops, I think it will fall. Yeah, so it's stable right now. I will briefly remind you that usually our, let's say, golden standard that we are, how to start it, it's not there. Usually we use for lymphedema treatment complex decongestive therapy that consists of everybody knows what, like manual lymph drainage, compression bandaging, skin care, and physical exercises. And we know that the effect of this treatment is like from picture number 1 to picture number 2, and then we maintain results with the proper compression garments. And it works, it really works, but the last picture for many patients is a problem. They hate garments, many of them they do, and they want to wear them as less as possible. So we know that sometimes it's not possible in the later stages of lymphedema, because what is happening, the vessels, lymphatic vessels, they are losing the function of their wall. So the functional reserve of the lymphatic system is going down. So compression, they are becoming dependent on it. Here comes microsurgeons. They're saying, yeah, but we can restore the transport capacity. We can partly bring back the functional reserve of lymphatic system. But the problem with microsurgery is that it still cannot remove the fat tissue and fibrotic tissue. And the thing is that still we cannot completely remove the compression garment. But still, microsurgery is giving promising results. It is, in many cases, if surgery is successful, that patient, let's say, get rid of compression garments at least partly, at least less hours per day, at least less compression class. And for many of them, it's the result that they really, really want. But microsurgery has also negative sides. Actually, there are a lot of limitations because it is a serious surgery. Not everybody can go for that. Risk of side effects is there, and it requires highly qualified personnel and specific equipment, and it is expensive. We know that it's not affordable for everyone everywhere. And the results are not very predictable. We still do not know exactly whether the side effects will happen or not. In LVA, there's still risk of occlusion. In lymph node transfer, there's still risk of necrosis, lymphocyte, and others. So is there a way somehow to try to restore the function of lymphatic system without damaging and without very, very expensive and highly qualified procedure? So here coming the BioBridge technology. It is scaffold made from highly purified bovine type collagen, and originally it was developed to reconstruct, to repair the soft tissues like ligaments, but then it was approved for lymphatic tissue repair. And the biggest work on that was done in Stanford University, and they found out that the structure, the folding structure of these scaffolds, they promote the angiogenesis both for blood vessels, blood capillaries, and lymph capillaries. And they did, for example, Dr. Nguyen, she did really a lot of works in Stanford University, and she showed that endothelial cells, they align the collagen scaffolds, and they show viability. They showed on the rat model that lymphedema can decrease. And how it happened? BioBridge provides multi-lumen structure for capillary flow toward the lymph nodes. At first, it's like tunneling effect, like we heard in a previous lecture, but also it provides the aligned collagen fibrils for migration of lymphatic endothelial cells towards the lymph nodes. But before recent time, BioBridge was used in humans in combination with lymphatic microsurgery to promote the effect of the lymph node transfer or lymph venous anastomose. And they showed that yes, if it is combined with BioBridge, the effects of lymphatic surgery is better. But the most problems are still there. If it is combined with microsurgery, we still have all the problems of microsurgery. Costs, very specific personnel and equipment, and side effects. So how to confirm that BioBridge is really working? To try by its own. So the idea today is to do a study and to make BioBridge implantation without any surgical treatment. I mean, the implantation itself, of course, it is a surgery, but it is a very, let's say, mini-invasive surgery, because you just put several scaffolds under the skin. You don't need to traumatize lymphatics. You don't need to transfer any lymph nodes. It is not that expensive. It is very easy and accessible because you don't need to be microsurgeon to do that. And of course, there are less risks of different side effects like we have in microsurgery. So the aim was to develop a new therapeutic approach that will show us if combination of CDT and BioBridge can change something in a better way for our patients. How we supposed to do that? We would like to compare the ICG picture, ICG mapping of a person before implantation and a year after implantation, and of course to do the measurements of the limb in different points. And the idea behind this is the idea of lymphosomes of Hirasoami. So these BioBridges will be implanted starting from the area with a very bad lymph flow that we see from ICG, and with BioBridge we are connecting lymphosomes with poor lymphatic flow with lymphosomes that have normal lymphatic flow. And what already have been done? We prepared a single-arm prospective open-label pilot study. And the hypothesis behind is that aligned nanofibrillar collagen scaffold in combination with CDT is reducing excess lymph volume for the patient with secondary lymphedema. It is hypothesis. The main primary endpoint is to see whether we will see some further reduction in the lymph volume. I remind you that it is not a new patient with non-treated lymphedema. It's a patient who already is undergoing CDT, but we know that compression garment that a patient is already wearing, sometimes it cannot work 100% ideal. So we still sometimes have something around elbow, some problems with the dorsum of the hand, some problems in the upper shoulder. So still there can be change, we can see the change in the volume. And the secondary objective, secondary endpoint is to see the ICG picture. Will we really see a new lymphatic or not? So I will not go into all these details. You can read, you can make photos. So the main idea is in this study to take people who are patients who have secondary lymphedema after breast cancer with axial lymph node removal, who already undergone CDT and who already are wearing the compression garment flat knit, and who want to participate in this study and to maybe get better results from it. Implantation procedure, as I said, is quite not difficult, and it is easy to explain to a surgeon how to do that. And post-implantation care is also quite easy. General surgical recommendation like short antibiotic prophylactic, antiseptics, and immediate compression, the same compression that the person was already using before. And the next year, he should not change the way of CDT that he is used to. For example, if he is going 2 times per year for CDT treatment, he continue to do that. And then we will compare what happened in a year time. So what countries are already participating in this study? Germany already started. In Germany, we have even control group. So we will have group to compare with who are doing just CDT without BioBridge. In France, preparing to start. In Greece, discussion. If some of your clinic want to participate in this study, you are very welcome to write to me. Or if you have patients who want to try it, who are afraid to go for a real surgery but want to get some benefits from BioBridge, they can be easily accepted to the study in any clinics that will be doing it. For now, Dr. Matthias Witt from Germany started. As I said, we are doing measurements with pyrometer, then we are doing ICG mapping, and we are doing video and photo fixation of all the patterns of ICG today, and we will compare in a year time later. And just recent news that regarding BioBridge, that a doctor from Stanford University won the best paper award on the Lymphatic Surgery Congress. Lymphatic regeneration visualized on MRI after replacement of aligned nanofibrillar collagen scaffold. So it really shows on MRI already, and I hope we will get more information about it. And Alisakov, he showed on a rabbit model the regeneration of lymphatic in the lymphedema that were done for these animals. And future direction, there are two more studies that are starting now. It is using of BioBridge for prophylactics of lymphedema after cancer and for primary lymphedema of the lower limb. So it is a very new approach without surgery, just implantation of BioBridge and CDT. And we till now do not know, we don't have answers. But like in the movie, we want to believe. But while we are believing, somebody needs to walk a dog for. So we need to do all the studies to have the reliable results. And like we already said today in the session, even if the result will be negative, it's also a result. I mean, either it works, either it not. We hope that it works. So thank you so much for your attention. If you have any questions, I will be more than happy to answer.
Thank you, Aleksandra. It's a great speech. The next speech